All right, so I'm going to look at the pelvis, or the os coxae. So two os coxae make up the pelvis, and it's an interesting bone because it's actually three bones that merge into one, and it is the ilium, so the superior part, the ischium, which is basically what you sit on, and your pubic bone. And those all merge to form the acetabulum, which is where your femoral head articulates with the pelvis, or if you're talking about one side of the pelvis, the os coxae. And so here we can see the acetabulum. It has part of the ilium, part of the ischium, and part of the pubis. All right, so let's look at the features that you're going to have to know. On the ilium, you have the iliac crest, and it can easily palpate that on yourself and on others. On the anterior portion, you have your anterior superior iliac spine, or the ASIS, and you can feel those bilaterally if you kind of just put your thumb near your where you think your hip joint is, and then find the bony prominence jutting out anteriorly. Just superior to that, but deep, you can find your anterior inferior iliac spine, or your AIIS, where your rectus femoris attaches, and you kind of have to go behind some tendons to be able to palpate that. On the posterior side, you have two prominences too. They kind of make dimples in your posterior side. Your posterior superior iliac spine, or your PSIS. And then, as you could guess, your posterior inferior iliac spine, or your PIIS. You also have your greater sciatic notch, right? This big curve. Obviously, you should be able to guess that your sciatic nerve comes through that greater sciatic notch. All right, and looking at the whole pelvis, so two os coxae together, and then you have the sacrum, right? Because your pelvis creates this nice bony ring, which is very stable, and then your spine begins to go superiorly from that. And you need to palpate the iliac fossa, which is on the inside. And you can kind of dig in on yourself and find that iliac fossa. You have your sacroiliac articulations, your SI joints. A lot of people have issues with their SI joints, kind of being a little too mobile. And so they are the articulations between the sacrum and each os coxae. On the ischium, you have your ischial spine, okay, and your lesser sciatic notch, which is a little kind of opening, and then your ischial tuberosity, which you sit on. You also have the ramus of the ischium, right? So this is your ischial bone. Ramus just means almost like a peninsula of bone, if you will, now that we're in the Bay Area. So you have this little piece of bone jutting out from the ischial tuberosity. And then when you look at it together, you have your ischial tuberosity, which is what you sit on. All right, now looking at the pubis, which is anterior, and your pubic symphysis you can palpate anteriorly. You have two rami, the inferior ramus, or peninsula of the pubis, if you will, and the superior ramus of the pubis. And then you have a pubic tubercle that's anterior and right where both of those rami meet. And then these peninsulas of bone, the inferior and superior and the ischial ramus, basically form this hole. And anytime you see a hole, it is called a foramen. Oh, I just found after years a typo. So this is the obturator foramen. And again, looking at the whole pelvis as a whole, when we're looking anteriorly, here's your pubic symphysis. You have the arcuate line that kind of separates the upper bowl, if you will, of the pelvis from the lower bowl. And there's your pubic symphysis.